boosting their confidence. All lies in the aftertation helps the person within the facility to know that despite what we've been going through as a family, we know it is not an overnight magic wand process. It's a long-term, lifelong recovery process. In our communities, supporting our beneficiaries. I think this is just our administrative process in terms of disengagement.
Okay, yeah, I'm just told that there's tea that has been prepared. If any of you wants to grab tea, you can just grab and come back to your seats while we proceed with the engagements of the presentations that we have had. But before we do that, I think Ms. Ndlovu, in your presentation with the skills development centers, as a portfolio committee, we recently had an opportunity to visit one of your skills development centers. I will not say where, but one of them in the province. And I think in that center, we did see the skills center working. You know, there's evidence to what you have been reporting here. But I think we also agreed that we are yet to visit some of the skills centers. And I think, as you correctly said, that much as we have these centers of excellence in all the areas, it's a matter of you working on the excellence part of it. So as the portfolio committee, we will also determine that and have a look at the other skill center that we have not yet visited just to see the excellent part of it. But I must say the one that we have recently visited, we could see the excellent part of it. But my concern is around the figures that you gave, the report that you gave on who you placed, where there a mechanism to follow up to see that, or is there a mentoring program to ensure that indeed the investment that you have made on these individuals is being realized, you know, so that there's value for money and there's impact on the work that you are doing. So I just wanted to check on how many do fall within the cracks, you know. Let's just have a global picture of the outcome of the work that you are doing. And Yvonne, I think on the presentation, the last presentation that you made on the FNF Ribeira, we got correspondence from the current board of directors from the FNF. In fact, they are inviting the chairperson and the portfolio committee to have a meeting with them. And I think they are well organized in terms of their fiduciary duties, as a board of directors. However, they are struggling with certain issues. Most of the issues you've already raised in your presentation. I think the issues around, the maintenance of the facility, which we know is a huge problem. And I think you have highlighted that issue in your presentation, the issue of water, the plumbing, the general look and feel of the building. So we are yet to convene that meeting so that we can have an engagement with them, so that you can be able to take them through, what is happening and what needs to be done. So we are looking forward to that in terms of the challenges that you have highlighted at Dr. FNF. So I will open for discussions, inputs, comments, or questions from all of you, including members, if they do have any questions or inputs that they want to make. And then I will take hands from the rest of you. Can I get an indication, members? Are you fine? Okay, thank you very much, honorable members. From yourselves, if you want to engage any of the presentations, this is your opportunity. Then I'll take hands so that we can then move to the, okay, I'll take number 1, 2, 3 at the back. So it's 3 hands on the side. 4, okay, 1, 2, 3. 3 on the side. So it's 3, 3. Okay, let's start with you, sir. And a roving mic, there's the mic. I think as professionals, I would request that in your inputs, if you do have solutions that you would want to recommend, please feel free to do so. Ne? Don't just raise problems, but if you feel that you have a solution around the problem, just indicate so that it can be captured. And
1, 2. Good morning, Chairperson, Honorable, and all the members of the legislature, and our colleagues, Ikamalami, Moses, Igama. From Swang Youth Project based in Katlehong. Firstly, it's on DSD. Yes, I can confirm in terms of a number of issues raised there. And my concern was on the issue of not being raised, the issues of other departments. I saw in terms of the strategy, maybe Ms. Kaliske did align it with the Provincial Substance Abuse Forum. Maybe she can clarify that. But I was thinking that the Department of Social Development is trying its most best. Just that you'll find that you have a number of departments that has a budget, but they're not, coming in board in ensuring that it assists, because the issues of drugs and alcohol abuse, the Department of Social Development is a lead department, but the act is quite clear in terms of the roles and the responsibility, but not only participating but availing resources in ensuring that the provincial substance abuse is active, is doing what is expected. Sadly, being one of the organizations that sit on the provincial substance abuse, we've been a number of departments are not playing their role. You'll find that there's only few departments that do, even if they do, but they're not bringing in terms of resources to help the department. Secondly, is the issue of day clinics. Day clinics, I think the legislature is failing organization like Swang Youth Project, the emerging organization, because the department took a proactive stand in coming with the day clinics and partnering with the city of Ekurhuleni. But sadly, Chairperson, the emerging organization are not given in terms of attention, because in Ekurhuleni, Sanka got 2 day clinics, Alra Park and Pamrich, which was supposed to be given to Swang Youth Project, which is an emerging organization. And because our members, especially in particular this committee, they are not doing their oversight role, and you are the one that must help in ensuring that at least there is in terms of emerging organization, they get in terms of their space. We know the history of our country, where we are coming from, and the legislature must be able to say those who've been there, they established, they must help in ensuring that those who are emerging, at least they don't just remain as doing the programs in terms of outreach and prevention only, but as well they are able to take a step further and move. That one. And we sent in terms of letters in that regard, to the department. Still, 2 years later, there's nothing which has been done. So the portfolio committee must go and check in terms of when was that organization established in Pamrich? Who's leading that center now, so that you get to see and compare and take to how it project. When was one established? When was it accredited? And so forth and so forth. And then you'll see. Thirdly, with regard to Umama with the issues of the skills program, I think it's a good initiative, but someone who's an expert who's been within the spaces of substance and drug abuse, I think it will make more impact to help our recovering service users, chairperson, if these programs are aligned with the organization that specifically deals with the issues of drugs and alcohol abuse. Why, Chair? Because when it becomes an organization that deals with skills program, our service users or recovering, they become vulnerable, because that organization is responsibility its own skills development. So they are not, in terms of into drugs, looking into drugs and alcohol and substance abuse in that manner. So our service users will be vulnerable, because you'll find that this organization will have parties, will have the closing and so forth, because they are not into the space of empowering our recovering service users and service users. But if those things are aligned, like the initiative that was taken by the department in terms of the day clinics, those skills programs are aligned with the organization that specifically deals with harm, demand, and supply reduction. I think in that regard, especially with drugs and alcohol abuse, it will make more impact on our recovering service users. Those were 3 of my inputs. Thank you so much, Chairperson.
Thank you. Number 2.
Thank you, Honorable Chair and Honorable Members and senior managers from our organizations and also from the department and other stakeholders. I'm Wandile Zibi from the Department of Social Development based in Sidibeng region. My comments chairperson was covered by the first speaker. Thank you.
Okay, that's very progressive. The third speaker is over there, the back. The lady, yes.
Greetings to all honorable leaders, colleagues, and members present today. Thank you for this opportunity, and I think thank you for the excellent presentations that were delivered. My name is Shaira Kazi. I'm from the Nishtara Recovery and Wellness Center based in Indonesia on Orange Farm. Chairperson, my input is directed to the presentation on the centers of excellence and the development centers. Just clarification on how do functioning recovery centers, I think the speaker before me also mentioned that, was how do we align ourselves with these centers? And also in terms of, I know you said that they are spread out and they reach, although there is one in every region, but they spread out to reach out as far as possible. Now, I think we come from Region G, and if we're looking at Turffontein and you look at the Deep South, it's not accessible at all in terms of costing, because most of people that are coming from those areas are the poor and vulnerable. What is the process also of accessing these services, and for rehab centers, how do we go about accessing it? Because there is a great need for this reintegration and the skills development for our areas. I think, and if we as an inpatient treatment center would like to expand our services by assisting or getting on board with these centers, if you could please just explain the process to us, or whether now or even the other question I have just is for Ms. Kalinski's presentation on the illegal, just referring to the illegal treatment centers. This has been a story ongoing for years and years, where these centers are mushrooming and our people are being taken for a ride and being abused by these centers. But what process this place, because I know the department doesn't have the power to close this down. They said it's a whole red tape thing that's involved in, but when are we going to do something, or does the portfolio committee have a role or authority in this thing? You could please explain. Aftercare is a very crucial part of the recovery process, and we welcome these centers that are there, but maybe more emphasis from the department side in terms of funding for aftercare needs to be focused in that area, because we get
Okay, thank you very much. Let's move over to the other side. The three hands, starting with
Now, my question is, we've got a lot of service users that are still in our waiting period that need a space to be admitted. I just wanted to find out that with them not having, who are not referring.
The speaker saying it caters for like children that are existing for foster care, young mothers in child support. So my question is, what's the age? Because I'm referring to our clients that are at the elderly, maybe above 35. And it's only for youth only, or do they cater for adults? That's my main question. And then the other question is for the Kimoja. I feel that the funding for Kimoja is a bit little.
Okay, let's take the last hand. May not be participating in the implementation of the GCR anti-substance abuse strategy. Can you just move the mic closer to you? Of social development side, we have written letters, I indicated via the attend the forum meetings, because we are saying that sometimes people will submit reports but not participating, but we have written progress report in terms of the Gauteng, in terms of the GCR anti-substance abuse strategy implemented. With regard to, I think, skills development, that was over to Ms. Ndlovu to indicate how people access those centers of excellence. I think there has been training from the Department of Social Development side with treatment facilities, as well as regional officials to urge treatment centers to optimally utilize the centers of excellence. We're saying after people have complete access the center, there is an underutilization of these facilities, but there's approached the police stations in a specific community. It indicated that the head of the Department of Social Development should lay a charge at the nearest police station, indicating that the center is operating illegally. We had a test case in Ikuruleni where we went to the SAPS in so the police was actually working against us trying to have that test case. In 2020, we had two test cases in the Sedibeng region where the SAPS accompanied DSD officials to remove people from illegal treatment facilities. So we went there with the police, and normally a social development that we want to take. We want to say we have a developmental approach. We tell you illegally, stop the operations. We remove the service users that need treatment to registered facilities, and we place them out. Other service users do not want to be placed out. So those in Sedibeng, they indicated they want to stay there. They are happy with the place, but the children we had to remove. So all the kids were then removed from those illegal treatment facilities. Then the facility would change. They're no longer an illegal treatment facility. They actually either a religious organization doing treatment for religious reasons, or others will say they are now an educational facility, so they're not a treatment facility. There are people there with addiction, substance use disorders. Every facility such as that needs to be registered in terms of Act 70. People going to rehab and the success rate in terms. Can you indicate?
Yeah, let me come after Mr. Grove, Chairperson. Thank you.
Okay.
in South Africa, 1 out of 5 marriages end in divorce in our country, and this matter. But where the battle can either be won or lost is the issue of supply reduction, Honorable Chair. And the land borders of the country, but also those who are dealing with manufacture behind the high walls of the sub-apartments that we work with, as well as community. So I cannot say that the cluster is not doing its best, Honorable Chair. We have seen some of the biggest drug busts in 10 tons of cocaine that was recovered by the police. And even I also wanted to from the substance abuse budget. And this happened, but while our emphasis in the design of our program is to make sure that there is guaranteed exit of programs, we also have to battle with the economic commodity is occupied by other people, meaning that it has got linkages to issues of, but we're trying the best we can to make sure that we deal with these issues in that regard. Chair, I want to believe my colleagues would have mentioned the importance of prevention in as far as substance abuse. We things that are abnormal in our society are being normalized through TV programs that seems to celebrate and normalize this social ills. Whether you are talking about Jola 99 to Mama Zala to Reatotella and all these programs where people's miseries have been turned into entertainment. And we did come up with a TV program called Kick It, Honorable Chair, which my colleague would have mentioned that it has won the Satma Award for the best educational program. And I'm mentioning this because it is important that educational programs in our screens must take their space to counter the wrong and negative messages that are always being projected about the society and its social ills in our TV screens on a daily basis. And the fact that we're able to reach 6 million viewers through this program suggests to us that it is possible to be able to run prevention programs, including on substance abuse, and reaching more people in the comfort of their own TV rooms without having to, call people into halls and stadiums where we struggle with attendance. So there are many efforts being made in this regard, Honorable Chair. Dr. FNF is a very old facility, Honorable Chair, and I wouldn't be surprised if they will be raising these issues with our agenda to build new facilities. And Dr. FNF is one of those that have been really highlighted as a critical area of intervention that will be focusing on. But it's not only Dr. FNF that does not record 100% utilization rate. We have got other facilities that are 100% funded by the Department of Social Development. For example, the facility in Randfontein and the one in Ikuruleni, forgetting the area now. Those two facilities alone, they are 100% fully funded, not subsidized, fully funded by the department, and they are giving us to the maximum because they were created in response to the community's outcry that 3 years ago we only had 400 beds. Now we have over 1,000 treatment beds that are fully funded by the department to be accessed by our communities for treatment purposes. A commitment from SAPS to assist us to manage these issues of illegal facilities. But the failure really is on our ability to enforce the bylaw, because establishment of such facilities should be regulated at local government level. And we are having this challenge of the failure of municipalities to enforce the bylaws in a way that at least will be able to assist us to manage the establishment of these illegal facilities. But this is also the responsibility of community leaders and civil society organizations to confront as and when these facilities come into play in our facility, in our community. 12-year-old, firstly being allowed to enter this kind of facilities, and secondly, this is also a parenting issue, that parents and families will allow. Okay, when you have got parents who say, I was surprised that my daughter of 14 years did not come back home at the usual time. And usual time meaning this is concerned. Because if we were to expect social development to provide all the answers, including making sure us to be able to improve and look at our blind spots and make sure that we do the best that we can to really reverse this trend that is threatening the existence of our society in Gauteng. Thank you very much, Honorable Chair.
Thank you very much, DDG, for the good summary that you gave. And I think I'm inclined to agree with you on the points that you raised, and perhaps just to emphasize on what you have just raised on the issue of civic education. Leaders in general in society, our behavior, how it impacts on the behavior of our children. And I think the issue of drugs, the issue of having to deal with the sources. Members actually do know the source. They know where these drugs are being sold, but they never come out to report for fear maybe of victimization or whatever. But I'm sure there are other means that they can use to ensure that they alert the law enforcement agencies that this is the house number 24 where these drugs are being manufactured or they're being distributed as a point of distribution. So I think as a society, we need to really have that political will, and then we have to have our legal systems in place. And the society in general, like I said, they have to be proactive in dealing with these challenges, as well as the assistance of our organized to participate in and not leave it to government alone to deal with this scourge, because it's escalating at an unprecedented level. It's just not a joke. And I'm sure the enforcement of the bylaws at the local sphere of government, I think we've talked about this before. And I don't know to what extent does the Department of Social Development in the province societal problems which affects our communities. And you spoke about the educational program on Mojalav. I've not seen that. I just missed the name that you mentioned. I'm yet to see that program, that the specific one that you spoke to. And perhaps it would assist. I don't know if it's possible if you could have a podcast of the various episodes as and when they come, so that those podcasts can be, or video clips can be shared widely as well in the community, just to raise the level of awareness, because some people might not have the opportunity to watch TV, for one reason or the other, either because they sleep early or they don't their phones which can play videos. So I think we really need to emphasize the inputs that were made and the questions that were raised. Like you said, will empower yourselves as a department to think some of the other strategies that you have already embarked on. Just and then maybe have an opportunity to discuss them, so that by the time session, people don't participate after lunch. So it's better if we conclude. Okay. To the podium. Okay. Everybody's trying to attend
the same program in our inpatient treatment.
But I just want to make a few input of the challenges that we face as a facility from time to time. Vandalism is one of the biggest challenges. I've heard that there is a big challenge at Dr. Van F in terms of the infrastructure. Users that we do expect challenges with that, but it's becoming a big problem from time to time. I'm not completing treatment, at some point after a week, then they decide that they want to go. Have as well when they have to refer the service users. I think also one of the challenges that we face is the issue of admission procedures. We find from time to time organizations want us to admit documentation when service users are referred to our facilities. It's always a big thing, as you know, that with COVID we had challenges. I want to believe that with maximum we'll hear from referral organizations, unless if if we are dealing with service users where we do not have
all the challenges that she has outlined, and I think it talks to in one of the objectives of our engagement associated with the alleged high dropout rate at government. It's not just a once-off treatment that you can do and leave. They have to follow on the program as it is outlined. So I think perhaps that is also one of the challenges, the challenge that actually confirm this high dropout rate at the government rehabilitation centers, and the other challenges that you have highlighted, including those ones of service users insisting on leaving because they don't understand why they are there, So perhaps if that part is better managed, I'm sure the outcome will be better in the long run. Of course, associated with other interventions as well. Let's take then the presentation.
The committee has a specific person representing Halfway House. From our side, we've covered.
I saw it as a standalone, so I thought it was going to be also covered. And I had the engagement with the Community Safety Portfolio Committee. And I think we have had a brief discussion with them before to say that we need to collaborate and share information, especially with regards to the halfway houses and the, what do they call them, the greenhouses, the green doors. Yeah, that is a part at the back, and then with the second one, and then this side, there's how many? 4 hands.
Thank you, Madam Chair. I'm Alazina Oakham from Sanka to going to inpatient centres. I'm sure I don't just speak for us as Sanka, but I'm sure for other outpatient centres and community-based, that we really try our best to prepare the clients. We do individual sessions as well as weekly group sessions. There might be various reasons. But I think my point I want to make is also somewhere we will also have to look at clients. Because there are clients that, everybody has its own agenda. Some clients, I will go to rehab. It's not obvious to say that they really want to, but I think what we also pick up is a client will abscond from one centre, and then maybe 2 weeks later we find, but he went to another organisation, but now demands he wants to be applied at another inpatient. That organisation might not know that Sanka already referred him to Randfontein, and then he absconded, or he vandalised, or whatever the situation is. So I think in such a way they also play around and take away the services for those that really utilise it. So maybe something like they feel that they want skills development, not just sitting and chatting once or twice a week in a group. But I really feel that the myths must also prove. Of course, the families are on our heads as well. It's not an excuse. But I just wanted to also think that, we have to really try to see what we can do. Thank you.
No, thank you very much. You are raising a very important point, the issue of abuse. And as the portfolio committee, as we go around doing oversight on some of the centers, like once we went to a center for girls, somebody who's housing, abused girls and stuff like that, you tend to pick up that element of abuse, of sometimes parents neglecting their responsibilities. It's better for that girl to be there rather than to be in her care because she wants to be busy with doing her own things and she's abjugating the responsibility to a home and stuff like that. So that element does exist. It is true. That's why I talked about, the multifaceted approach in dealing with these issues, because there are so many reasons that surrounds, the challenges that are being experienced. Let's take the second hand.
Thank you, Chair. Igama uThembo kaKhanyile from Soweto. I just want to add on what my colleague from Sanka has said. These users, at times they come to the facilities and some are brought by police, by the law, and some are brought by the fact that my mother wants me to go there. Some they do want to change, they do want to go through the rehab. But now, because of their mind changes frequently. Remember now, these people have been doing this thing for the past 10 years. And as I stated, that addiction is a disease. It's a mind-buffering disease. The mind changes every time. So what I would suggest is, maybe, because I'm definitely sure we do our best to assess them, and they want to go to rehab, but they get there and they have it's difficult. I'm a recovering drug addict myself, who's 14 years clean, well supported, and they feel that, I'm better off in the street using. I mean, I know of people that I only went once, but we also need to be patient, and we also need to work together as Sankas and the rehabs.
And Yvonne, I think there was also an input made in terms of the biometrics, the central database, just to mitigate the issue of abuse.
Mine, I would just want to direct this to, but it's a compliment. Maybe they can make a follow-up with Eguruleni municipality so that they can give us that places again. Because we always refer many service users in the rehab centers, but when they come back, you'll find that some of them, they will but after that, we know already that if they already detox, if they will go back to substance use again, the way you look at them, they will look terrible. And then, I don't think we are giving them a full support. But I would like to thank social development by their effort. But then now maybe, I don't know who Ms. Des, our director there, because we went this through with her so many years, they are still aware of that thing, that we still need to do that daycare and even skills development, because I don't think I will rest in peace while I do not achieve those goals for Tembisa communities. So another thing, the second one, I want to oppose this to Dr. Fabian. Okay, Dr. Fabian, we do have a good relationship with them. Now we are aware of what do they need, especially in connection with medical assessment report. We are very much careful with my team So then they don't give us any problem. They do admit our clients in larger numbers. But my problem with Dr. Fabian now, they are no longer provide us with the reports after the service users discharge. Thanks very much.
By Elicha, Fos Lores Community-Based Services in Fos Lores. Social development as well need to be established. Community centers, artisan workshop. This is what we need. Madam Chair, siyacela, please.
Maybe it's a question or a comment. It's directed to Dr. FNF Ribeiro. I would colleagues from Sanka, the lady and the gentleman, in terms of the treatment at the facility, like it's sometimes not good, that it's either it's not so clean. Sometimes the patients who are at the rehab center via court order, they tend to like assault them, like they are always like some sort of bullying, if I may say. So that thing, like you can imagine, like what's happening there, like. Maybe like, I don't know, I'm some of the things that they're saying that the treatment, it's not so good, like, I don't know. And then the other thing is of getting the court order, because sometimes our service users, they are not willing to get help, but then you see that the family members, they are suffering. It's targeting their mental health. Like in most cases, it seems like they are losing their sanity. In most cases, they are, whereby even me as a subs, like for me, that's what I think the issue, like we shouldn't only focus on helping the service user, but
good afternoon, Honorable Chair and the members. Good afternoon, colleagues. I'm Vuyelwa Funeka. I'm a social worker. The challenge that I'm facing as a social worker at the Center of Excellence is that the ex-social workers, once they refer they don't do follow-ups as to when are they coming, link them with the Center of Excellence. So that when the program starts, they are able to get the opportunity. Sometimes they are discharged whilst the program it has already started. By then, I cannot say, let's take to Bambisandla Sam. They are no more in the picture. And the ex-users, sometimes I won't know that they can attest to that. But me personally, it frustrates me, because I'll also be doing follow-up calls when the ex-user come to our center to say, can I send her to the family? It shouldn't be only that I have referred as a referring social worker. Now it's the ex-user is out of my hands, anything anymore. Thank you.
Wait for the mic.
Good afternoon, good people. My name and the chair, included the chairperson of the day. My name is Shamin Ali. In terms of our safety, I'm the organization that is referring to Sanka Pambridge. So they came to my gate, next door to my gate, say to me, we know about that, just take the registration number. I'm not safe because they will say it's an anonymous, but at the end, they know it's me because I'm amongst the community. And the second question, what about the community? Because from my side, e.g., they stole an, what you call this, the kettle. And then they go to the next house. I'm suffering, I'm crying about my kettle. Because the community is busy and killing the drug.
Your submission. I want to now at this stage give the department an opportunity to just respond. Thank you very much. Yvonne?
Okay, thank you, Chairperson. I think I'm going to respond, and then my colleagues can add to it.
we can close on this sector. Hopping from one facility to another, and that for me is a waste of resource to acquire the services. From a national a system that is currently being worked on, I don't have enough information, but maybe Des, you can add engage our NPOs as the system unfolds, and how do we roll it out to the NGO sector as well. But it is a process that is unfolding at national departments side. In terms of the requirements of Dr. FNF, and I think somebody has acknowledged, thanks for listing exactly what the compliance requirements are. But they further said that no reports are being provided. And I'd like Desiree from Dr. FNF just to respond on that, because in terms of our understanding, professional reports should be available and ready and accessible on the services that were rendered at particular client, while some clients are just not happy with the services that they've received whilst at Dr. FNF. I want to ask Chairperson, you find families so desperate calling the department, please, as soon as a threat is made to call the law enforcement, that drug user runs away, disappears for a couple of days and come back into the family, then seeking remorse again. So it's like this vicious cycle that happens. But I feel at communities and vulnerable persons within communities, just thinking of that example of the older persons that will protect the abuse of that person. But I think we need to be, I think the rotation of social workers. Madam, I think I want to say that DSD has moved out of rotational, all rotation. The only place that is allowed or permitted from the HOD's point of view is where our office space is being renovated, or there's limited office space because DID has now moved in, taken over a particular office space and are renovating. But every other instance, all social workers should be back at their desks rendering services from our satellite offices. So in the instance where you are saying social workers are on rotation, it will be good to hear what are the dignities against the scourge. Thank you. I'm not sure if the DDG was online or the colleagues want to add a chairperson. Thank you. Yeah, I'll just check if the colleagues want to add. And DDG, are you still online?
Thank you.
Okay, thank you very much. Yeah, I see Ms. Ndlovu.
Thank you, Honorable Chair. I think there were concerns from Eguruleni in terms of the training centers or the skills development centers. I think it was First Loras that was mentioned and Tembisa. I just want to place it on record, Chair, that we've got quite a number of skills development centers within those townships. And what we'll do, maybe through our social welfare services colleagues, we will share the database with addresses of all the skills centers so that with their counterparts. Thank you.
Okay. 7 system within the Gauteng Department of Social Development, where we are created, and when they are referred, the referral is also being tracked. But this is in terms of all the services, in terms of social welfare services. Then the National Department of Social Development is tracking with the integrated justice system the quality of services
names. I can fast track it because our process in the institution is that it's either emailed or it is posted, and that they come and fetch it when the modification, where people are seen if they violate anybody's right, care workers. But if I could get the specifics, I will also follow it up, because it's the first time I'm hearing of that with my sectional managers. Do the motivation intervention and ensure that they try and motivate a survey on how many admissions we had and how many admissions, 350 self-discharge. The client will also have psychiatric challenge, social development.
Just give her the roving mic.
No, we have a mic here.
Oh, okay,
Yeah.
Proceed.
Just a quick one. I just wanted to share with our colleagues as well that dropout will always be a challenge. And what are those instances that are just beyond our control? And I mean, there's a lot of these determinants, and some are speaking to, previous psychiatric treatment, things like, lack of activity on our side, low education. But I think the most important thing is that when we do have a treatment dropout, how do we of our service users when they are inside? We do have measures like our customer satisfaction surveys that we look at on a monthly basis just to get feedback from our service users as well. That just assists us with our services and make sure that we have big facilities. We have a 350 bedded facility. If you are talking of a detox ward, it's not always the same. These stakeholder meetings at the treatment level. I really plead with.
And like I said, I had invited written submissions. If there are any, they can come through. And I think with the department, we will, and I'm sure you have seen, I was aggressively making inputs, taking notes here. And as a committee, we will have an opportunity to discuss that report with the department to ensure that what needs to be implemented is indeed being implemented, so that together we are able to shape our society and fix the societal problems that we are faced with and depart to our various destinations. Over to you, Honorable Ledwaba.
In absentia and Tate Kabasia in the virtual platform, not forgetting our champions, which is yourselves, that are there for the communities at all times, at all cost. And we wish you the best in everything that you are doing in your respective. To all the presenters, all the presentations, Chairperson, I must say that they were on point. Us as the committee, we want to take a ring for us. I want